Today we're going to be talking about arteriovenous malformation. Now what is that, you might ask? Let's go find out with a little help from my good friend, Mr. Jack Howell. Good afternoon, Mr. Howell. How are you doing?
Good afternoon, Andrew Califano.
Prior to my interview with Mr. Howell, I did some research on arteriovenous malformation, or AVM. An AVM is medically defined as when a tangle of blood vessels in the brain or on its surface bypasses normal brain tissue and directly diverts blood from the arteries to the veins. However, to get a more relatable understanding, Mr. Howell provided me with a few metaphors.
Have you ever tried to hook up a large pipe to a small pipe? Have you ever tried to use a large hose with a smaller hose? Have you ever taken a large straw and put it in a small straw? That's what it was like in my brain.
When did you first find out that you had this condition?
When I was 16, I didn't know them at the time, but I have small seizures. So I would smell funny things. I would lose all my short-term memory. I'd have to sit down, feel pretty woozy, dizzy. Never lost consciousness. And I don't know, I just thought maybe I was getting up too fast or waking up too fast. But they were happening with more and more frequency. So eventually I told my parents that I was smelling funny things, forgetting a lot of things. I would lose my memory for maybe 30, 40 minutes after one of those. Not all my memory, just my short-term memory. And so eventually I grew up in a county that didn't have any MRI machines, anything like that. So they had a number of sleep-deprived EEGs. You know what an EEG is?
Yeah. And
they said there's something going on in your right temporal lobe. And so they said we really need to go check that out and sent me down to an MRI machine in Richmond.
How did the first initial news that you had this condition affect you and your family?
Andrew, imagine if you're a senior in college, in high school, and your mother comes to school, pulls you out of school, and tells you you're bleeding throughout your brain. You have a very serious condition. And oh, by the way, we're driving to Charlottesville today because you're going to have surgery tomorrow at the University of Virginia Hospital.
Going into his surgery, Mr. Howell had right to be worried because he was about to be a patient in a surgery where, in serious cases, 1 out of every 4 patients does not survive the procedure.
So you went to Charlottesville for your surgery. Then what happened?
Shaved my head, gave me some surgical prep, and then real early the next morning, they cut out a pretty large part of my skull, and then they removed my right temporal lobe, which had this growth, this malformation in it. And then they tried to sew that up so it wouldn't bleed, put some clamps on some of those blood vessels, clips. And then they tried to put my skull back together. And then they put me in the ICU and let me try to get better.
How long was the recovery process after your surgery?
I was in the hospital for 4 weeks. And then had to have physical therapy, occupational therapy, homebound teachers. I don't know, it was a long recovery.
Did medical insurance help you significantly, or was it kind of a burden for you during your procedure?
I don't know that I know the answer to that. I know that my parents had medical insurance. It's hard to imagine that their insurance would pay for as much as all of these procedures and subsequent follow-up and therapies cost. My sweet parents never mentioned how much I probably put them in debt. I think they were just glad that I was living still.
Unfortunately, brain surgeries are very expensive. Mr. Howell's condition's preoperative, operative, and postoperative costs could have reached over $100,000.
Where do you think the AVM developed from? Do you think it was hereditary?
So an AVM is congenital. So you're born with it. I think in my case, the abnormality of this blood vessel growth was limited just to my brain. Most people that have this have a lot of other venal malformations throughout their body. So I didn't know it was there until about when I turned 16 and it started to leak. when I began to experience those seizures. My doctors told me consistently that usually with AVM people, they don't know that they have it until they've either had a seizure or a stroke or they've passed away from an aneurysm. So, something you're born with.
Are you concerned for any possible relapses in your condition?
So they removed all of the blood vessels that were poorly formed and poorly connected. And so there's nothing there. In fact, Andrew, there's a really large empty space in my head. You might say that I have a head full of air. So it'd be impossible for me to have the symptoms attendant to an AVM reoccur. What I have had subsequent to that are maybe 2 to 3 periods where I have episodic seizures. You might call them in the pre-med program idiosyncratic. No pattern for them, no reason for them. I've been on seizure medicine a number of times for a long time. I don't know, they seem to go away. I didn't have any more reoccurrence of those.
How did your condition and your procedure affect you emotionally?
That was a pretty emotional time. 18 years old. You think you're going to live forever. And suddenly you have to sign all these releases telling you that you might not make it through the surgery. I couldn't really walk with my left side. I drooled a lot because my left side of my face was weak. Couldn't remember a lot of stuff. Couldn't remember how to do long division. Struggled to not drag my foot behind me. Had a bald head with a large scar. Had lost all my left peripheral vision in both eyes because they cut that part of my optic nerve. So I'd say it was a pretty big change that probably led me feeling humble, weak, probably a lot more anxious or fearful about my abilities and capabilities. I was supposed to go to college in 2-3 months. I don't know, I was a bit of a mess.
Do you suffer from any of the effects to this day?
Andrew, I think the effects of this are more my deficits. You know me well enough to know I have significant deficits in a lot of areas. But I will always be weaker on my left side than my right. I won't ever have more than 110 degrees of vision. I won't ever have my right temporal lobe, which does a significant amount of brain function. An example of that, my wife, so the right temporal lobe does facial recognition. And she thinks one of the reasons I don't do as well remembering people is because I don't have that part of my brain to help me. So, I wasn't ever really a good athlete before, wasn't ever really that bright before, wasn't that neat of an eater before. So, with all those things, or a good driver, all those things are probably just now exacerbated.
How often do you get checked out by a doctor?
If I don't have any symptoms, I don't ever go get checked out. I hope I don't have to go back to my neurologist, because if I do, I'm in real trouble. It's not supposed to grow back, but I'm sure that my brain is probably more likely than others to have a seizure because it's missing so much of it.
How has this condition shaped your life or you as a person?
I think the AVM profoundly shaped my life. I was 18 years old, king of the world, accepted to college, thought I had the world by the tail, and suddenly you're confronted with just how very short, fragile life is. I think that the AVM really strengthened my faith. You're in the hospital for that long and rehabbing for that long, not able to walk without a cane or drive, or stop your face from drooping. It's pretty humbling and makes you appreciate people more, probably did for me the church more. Just, pretty fragile view of life. Certainly made me a whole lot less confident in my abilities, my strengths. I mean, it really knit my mom and dad and me together. I was thankful for that. I don't know. I mean, I hope I play sports or live life with a little more gratitude than I would have ordinarily.
Thank you, Mr. Howell, for your time and for sharing your story with me.
Thank you, Andrew. Thanks for listening, being interested.
Yeah.